Hello and welcome to the Go Television. Here we are in the picturesque village of this Tapobhumi Kundai, and we have a very eminent guest and a friend of ours from Germany, Dr. Ulrich Randoll, who is a doctor, who is a writer and a researcher in the field of systemic medicine practices or the approaches. So, doctor, welcome to this Tapobhumi.
So thankful for this interview, and I'm so happy to be here at this nice place here in the ashram from Swamiji, and so that we have the time to talk to each other. And well, it's wonderful to be here. I like the climate, and it's wonderful. Thank you.
So, Dr. Ulrich Randoll, how you find India?
Well, I like it very much. It's not the first time that I'm here, so it's now my fourth time coming to India, and I like it more and more, especially the philosophy of the country, the philosophy of the people, how people are living, and especially the tradition of the country I like so much.
Well, Dr. Randoll, when we talk about the philosophy and the lifestyle, so you are a pioneer in this concept of matrix rhythm therapy. Okay, which actually connects the functioning of our body to the rhythm and to rhythm of a life. Okay, so how this whole concept of rhythm and a matrix. So to educate our viewers, so matrix rhythm theory is all about rejuvenating the tissues, okay, and getting them on a rhythm. So how this whole idea or the concept of this rhythm therapy started?
Oh, that's a long story. The story started about 20 years ago when I started at the University of Erlangen in the department of maxillofacial surgery. And my patients were about tumor patients, about 70% with these maxillofacial problems, tumors here in these areas. And these people had, beside the tumor, of course, big pain problems. And I was very enthusiastic in those times as an assistant surgeon. And of course you just start, and then I observed very quickly that our operation that we offer to the patients, and also the chemotherapy and also the radiation therapy, is not sufficient. That means we do our very best at these university units still now, but after long operations patients die. And so my question was, what is the tumor? What is the pain? Where does it come from? And so we see that it's not only a local disease, it's a general disease of the whole body. You have to ask for the immune system problem, but then of course you see that these patients are sometimes very depressive. There's a mind also, not only the things that you operate, there's something beyond. And so as in those times I said I have to study on the one side the whole body and go more to the larger dimensions, but on the other side I wanted to focus into the body and to analyze what a tumor cell is different from a normal cell. And so I had in those times a video microscope, that is a microscope different from electron microscopes. Electron microscopes, they just you can observe dead structures, the rest of life. But what I could see was the cells alive in the same resolution or similar resolution. And suddenly I saw when these cells were surrounded by the plasma, like the fishes in the water, I saw that muscle cells that I also analyzed were pulsating. Heart cells were pulsating. And so I saw that the rhythm that, for example, is produced from our heart can gun down to the tiny areas of a single cells, and even there we see that the cells are oscillating and producing a certain rhythm. And in those times I was directly confronted with Chinese medicine and also the Indian philosophy of Vata, Pitta, Kapha. What is it? You have different pulse qualities here from this muscle here. But how can you measure it? Is it measurable by objective values or just by people that have learned it? And up to now we know that Vata, Pitta, Kapha system cannot be measured by machines. It is a very subjective measurement by people that learned it 5 years, 6 years or longer.
It cannot be quantified.
It cannot be quantified. Yes, it is just a feeling from some people who have the senses, and this is standard in other countries, but not in the Western world. If I go with Vata Pitta Kapha to Germany, they will say, oh, this is something very strange, it is not measurable, so it has no scientific value. Yes? And so that was the first time I was confronted with these rhythms from my cells, and on the other side, when I extrapolated to a macroscopic organ, that there I have to deal also what is science and what is not science, you know. So
doctor, just to simplify these things, okay, what are day-to-day diseases which is related to this therapy, and which could be therapy could be actually applied to this kind of a diseases, maybe for chronic disease and other diseases also?
So with my microscope I could analyze just the management of cells. I had the fishes in the water, the cells in the plasma dishes, you know, and so I changed just the environment from the cells, and I got different cells. So I could really guide the cells. Did I want to have, for example, in a low pH you get cell division, and in a normal pH or in an alkaline pH you get a cell you get cell differentiation. So the pH, that means the base acid content. If you have more acids or more alkalinic substances in the around the cells, they decide in which direction the cell is going. And so I concluded that this might the nutrition might also have an influence maybe on the cancer. And in those times when we had really cancer that we did not want to touch because it was too huge, you know, nearly hopeless cases, I said then I want just to try by general conditions that I changed how to influence, or if I can influence the tumor. And that was possible, you know. I just, instead of beer and other alcohol types that people had, unfortunately, of my patients, and big depressions, what I had at the end result was a changing of the body when I gave, instead of alcohol, just water or healthy nutrition, that had a very good result on the tumor growth. That means the growth was reduced, you know. And this stimulated me in some cases, not in every cases, but this stimulated me to go further on to study the cellular regulation, the principle of the cell regulation. And so I came to the point, who is responsible for the environment of the cells? It is the microcirculation. And who is responsible for the microcirculation? At the end we found out it is the skeletal muscle system. By the skeletal muscle system, we found out when the body is shivering like this, trembling, when are we shivering? When we are angry, or when the temperature is low, we are shivering because it's cold, or when we have a fever. What happens then? When we have fever, then we get the problem with the shivering also, and the high temperature. That means at the end that with microscope that we put here on the fingernails, we found out when the muscle is shivering here, we get an activation of circulation here. That means the contraction here, the shivering, brings the blood from this point back to the heart and makes the space free for the new blood from the heart to the point. So it optimizes the logistics, the turnover of the flow. That was very important for us.
And that is where this concept of rhythm exists.
Exactly, and therefore, and so I focused. Coming from the field of surgery, I went to physiotherapy now, because the physiotherapists are dealing with microcirculation, with electrical therapy, with ultrasound, with all these things. And then I looked what these machines are doing, and then I saw that most of these frequencies that are used produce stress in the body. And at first I started with magnetic field treatments, but then of course in those times, 20 years ago, the first mobile phones came on the market, And then the one group of people, a small one, was saying these mobile cell phones and the emitters, they produce tumor in animals or humans, brain cancer and so on. And this discussion is going on till now.
Still the discussion is making the rounds.
Exactly. And on the other hand, now I go to the department of physiotherapy and they take also magnetic fields, put it on and say this is treatment. What is the difference from physics? And so I said, now I have first to analyze the music from the human body. What is the human body producing? Electrically, we have the heartbeat, we have the brain electricity, but also the muscle electricity. So the body produces electricity, and of course, if we have electricity, we have also magnetism beside. You cannot say either or, you know?
So that's where the vibrations come in play.
Exactly.
Study of vibration.
Study of vibration, because I saw that the whole body is processed, and of course, clinically we say in the Western medicine, if the heartbeat is 0, if the brain beat is 0, somebody is dead. But what is now the difference between a living system and a dead system? You can just say, if you just have a living system and minus its cadaver, then you have the life in between, you know?
So, Doctor, in a modern world, so when we talk about this matrix rhythm theory, everybody would, which looks very impressive, but everybody would like to know, so what has been the success rate of this therapy?
Yes. So I just want to tell you why it is successful. Because we use now a physiological rhythm. And the rhythm that we use is exactly the shivering of the body. We produce the machine like a crank of an engine, a starter, where we start this physiological rhythm to bring the blood back to the heart, and then from the heart on the arterial side the system can bring fresh blood, and also the venous system is activated very, very much.
So what has been the success rate of this therapy?
Success rate compared to what? And to compare to which cases? I can only say I started with the worst cases, nobody wanted to touch, and I made from worst cases best cases. So I had suddenly the evidence something is going on here I couldn't do with the machines or the tools I had so far. So coming to the point that there must be something very special with physiological rhythms, I continue to optimize the machine, and now we have an international accepted medical device for this, like a crank. It looks very simple, where we activate the body intrinsic rhythm, and what we do is we optimize the logistics. That means we can only optimize the environment, and then we have to ask what is healing. Is there a healer in this world? You know? And I can tell you there are as many healers in this world as human beings, because everybody is his own healer. And what is the doctor now doing for the patient, or the therapist doing for the physiotherapist doing for the patient? He can only optimize the environment down to the cells. Hopefully his treatment goes down to the cells, so that by self-organization, because now I have to deal some words with creation, and the whole creation is self-organization. You put a seed in the ground, you put some water on it, and it starts to grow. Who does it? Where does this energy come from? This is creation, creational forces. And such creational forces everybody has in us. But when a healing does not happen, then these healing forces are blocked. So take the blockages away, and the forces will start the healing process.
So one more question to you is that what you talk at this point of time could be categorized in a philosophy of life, maybe a philosophy of a life, philosophy of living. This is a country of Ayurveda, this is a country of yoga. Okay, how does therapy, or how you connect your therapy to Indian philosophy or the Eastern philosophy?
There was a link by the sports medicine, because when I was dealing with muscle system, many people had pain just in the skeletal muscle system, rheumatism, fibromyalgia, or just some contractions in the muscle after hard training. The muscle became stiff. And now I saw that when you have no circulation in the muscle, the system contracts. That means when there's a lack of oxygen, the system contracts. And when do you have a lack of oxygen? If you stop breathing, when you are stressed, when you do not breathe enough, you know. And so, who is breathing? All people that are starting with yoga. You know, the breathing is a very big topic in the whole yoga field. And so,
absolutely,
I listened.
It's a very sacrosanct issue in
Exactly.
yoga.
And so
That's where the
also to
whole
yoga.
the practice of yoga is surrounded. It's surrounded around this breathing.
Exactly. And the reason is we need the oxygen in our tiny areas, but how does the oxygen come to these tiny areas? Therefore it needs this cell vibration, because you have always to get rid of the lymphatic and the venous pathway, and then the fresh blood can come. When there are hardenings, you cannot bring the oxygen to the tissue. That's the big problem. And so I saw many people, many yoga practitioners in Germany came to my clinic. Meanwhile, I have a private clinic there, and they are suffering from pain. And then I said, well, your muscles are totally hard, but I'm doing yoga. And the point was, it was not the circulation activated. So the question is, you know, how the muscle works. I will make it very simple. When life is over, we get the so-called rigor mortis. Why do we contract and produce force when life is over? And there I learned that the contraction is passive and the relaxation is the active process. I will show this later in a film where you directly see that the contraction is passive and we need the oxygen to stay relaxed. And all the stress in our body makes the contraction. When we are stressed, we are not relaxed. And this is the big problem of our stressy life every day, also in India now, that people are more and more have the so-called burnout because they don't breathe, they are horning, they are shouting, they are running, they have the business every day, but nobody has the time to calm down. And so I learned that the passivation is more important in modern medicine than the activation. And so at the yoga conference I met also Swamiji, and that's one of the reasons I'm here today, to talk with him. And because the stress, what is stress? Stress is something in between the ears. So how can I deal with stress?
So that's what the problem in especially in the countries, developing countries like India is, and this is how maybe Germans would connect to India. That India is a growing economy, and we are extending in a services sector. Okay, more technically based, or the IT firms coming in, and we also have the health or the lifestyle related issues because of our working practices. Okay, all the day we are occupied with the stress and the office related works. Yes. Maybe sitting on a chair and working on a laptop or programming on a computer. So what are these lifestyle related issues or the diseases? Do you find these diseases as a threat?
Yes. So the modern diseases are coming from our lifestyle, of course, and most are coming from our conveniences. You know, who walks today 10 to 15 kilometers? Everybody sits in the car and we don't move. That means we don't use our lungs, we don't use properly our heart, but we eat as if we would have gone 20 kilometers, you know. So the eating has not stopped, but the walking, you know. And so the energy is stored, and at the end we get all these problems that we have as diabetes, high blood pressure, coming all as a mismanagement of the human body cells by a wrong mindset at the end. And so the mindset is responsible for the outcome at the end. Like in a company, if you have the wrong CEO there with the wrong idea, at the end of the year you can close the company. And before you close the body, it produces diseases. So this is now the nice systemic concept. You can compare the societies to the human body. You have just to deal with the processes, and you have to reorganize it in a proper sense. And what is now the proper sense in a human being? Do it like evolution processes have created it. If you copy creational processes, then the system shifts back to normal. That means start to move, eat the right things, breathe enough. This is, I will say, 80% of what we have to do.
So in medicine or in whichever area, we consider life as a process.
Yes.
Okay, it cannot be a commodity. It's a process. Okay, so but we live in a modern world which runs on this thing called evidences. Okay, you have to prove everything.
Yes.
Okay, and when we were talking about, when we started this conversion, so whole this idea of rhythm cannot be evidential. Okay, rhythm has to be felt. So what kind of problems that you faced in a field of medicine to prove your kind of therapy?
So the rhythm is very much proved. We say somebody is dead if he has no rhythm. And now we have to see two life aspects. The one is the so-called night time. It is stress-free, hopefully, and you have a nice sleep. It is the so-called parasympathetic system, and this is rest and digest. And the other side is fight and flight. This is daytime, and horning and shouting and fighting and so on, or frightened, shocked, This is sympathetic, parasympathetic system, and this has to be balanced. But it is not balanced in nobody who is living in a big town. Go to Mumbai, go to here to the city, it is not possible. Because just the air pollution is the one side, the other side is the acoustic pollution. People cannot sleep even in the night because there is no quiet, peaceful surrounding. That means at the end that even during nighttime you have not a deep sleep, you have not a nice dream, you have nightmares maybe. And so when people have stress from day, in the night they're starting grinding, they get tinnitus, they get headache. So they cannot relax the system. And what means relaxing? To breathe, to regenerate, and the battery must be filled so that you have the energy in the morning, a new day and new action. And this is not so. The sympathetic parasympathetic system is not working properly in the human beings of today. And so during daytime, you have no power to work. You're just sitting on your chair, but you have no ideas. Your mind is going down and down and down. And at the end, you feel very depressive because the whole performance is decreasing. And at the end, people are sitting in front of the television and just eating. Yes, this is the only thing they can do, and very frustrated. The only joy they have is to eat.
So when we talk in context of India, so
Yes.
what are your experiences or what are your influences of Vedas?
So I'm not so familiar with and deep inside the Vedas, but I have the feeling, that the Vedas, as a manual of life, has prescribed everything, but it is not lived for many people today. And nowadays it's very interesting because we can, coming back to the rhythms, we can measure very, very exact now the rhythms during our daytime and our nighttime in so-called pattern recognitions. And you can analyze a sleep profile very, very well. For example, we do it on pilots in Germany, a 24 hours profile, and you see in which moment he was stressed and where he was sleeping, and this and this and this and this. So since about 30 years, since we have the huge computers and everybody today has a computer, we can get time profiles from human beings that show directly are they stressed or not stressed. And the stress has a big impact on the immune system, and the immune system has a big impact of cancer growing, for example, you know, or the immune system is the police of the body, and if the police is not trained and is just suppressed always, how can a government survive without police? You know, you have the same problems there. So at the end you get these diseases because the imbalance of the sympathetic and parasympathetic system, and I'm sure that in future time we can analyze the meditation, we can analyze and give a real meaning of this, you know, because we know how important it is to be connected to, I will not directly say spirituality, you know, but to the creation, you know. What is the sense of life? Why do we work every day? It must have a sense behind. It is not just gambling around and chaotically gambling around. There must be
about knowing your existence, why you exist.
Exactly. And what we see, what evolution brought all these years was a condensation of information. And what is mankind now doing with this information? Just getting information to destroy it by the next wars, or do we go to the next dimension? And I think creation has the capability to go to other dimensions in a scientific method, because we have the tools to measure it, but they are not used so far in classical medicine, in textbook medicine. In some laboratories they start, you know, but this will be the future of the next 50, 100 years of Western medicine, to go to this time-based cell vibrations and to analyze what they are doing. Because everything is oscillation, and it's a kind of coherent state. The coherent state in oscillation, in vibration, this is what more is reality than just anatomical structure, where we start with.
Yes, again, doctor, simplifying these things in the modern context, that you are researching in this chronic diseases for last few decades, and you have headed several work groups, okay, research groups. What kind of patterns you find in this chronic diseases, or how the pattern has changed? Because you have this idea of human evolution, studying human evolution, because that's what differentiates us with the rest of world, that humans evolve both physically as well as mentally. Okay, we think differently. So what kind of a changing patterns that you find in this chronic diseases?
Yes, so today I must say that most of people that were suffering from chronic diseases, these are self-made symptoms by a wrong mindset. Or wrong is always a hard word, you know. The point is, you know, by our advertisement, by all these things, buy this, you know. If you have a newborn child, the advertisement tells you what mothers have to buy, you know. So we have to analyze if this is the right way, how to go to a healthy future, you know. Because we are a product from natural resources and not from big companies that maybe have not the evolutionary ingredients inside, you know. And a vitamin that is coming from nature is different than a vitamin coming from a company, you know. There are differences in biocompatibility, in resorption, and all these things. And India is such a huge, brilliant country, and you have the sun in the most parts. It's warm. I mean, of course, sun you have every day in your country, but it's warm. So you have the fruits, you know, and the fruits is so important to have the fresh fruits every day, the fresh vegetables every day, and this is much better than just the food that is conserved and is not living anymore, you know. This is very important to eat these things for the future time. You can say the kitchen, you know, around a human being is the nature, yes. But if we poison now our kitchen by the air pollution and other toxins and so on, then of course this is at the end the poison for our cells, and this will produce in the long range diseases. There's no way.
Well, again, putting it in Indian context. So
Yes.
you have traveled in, you have been in India. Okay, you have been in India and you have traveled in India. Okay. Uh, so what are the issues in Indian medical practices that you find which has to be addressed?
So in India, I find the whole range of possibilities, and I find so many open-minded people, and of course everybody has his own interest. For me, the only question is always: is the interest against nature or with nature? We must have interest, because this is intrinsically in evolution to have interest, if you have certain conscious. But we have always to figure out how far is it for the evolution or against the evolutionary process. And so at the moment I see two trends, in India. The one is, of course, the Western medicine. You operate and operate and operate. And I read a nice article in the Times of India when I arrived here in Goa. And they said that about 90% of the operations from back spine are not necessary.
Oh.
So it is, and this is a high percentage, because they said it's not a spine problem, a bone problem, it's a musculoskeletal problem, and I really can confirm this. Of course, I understand a surgeon who wants to operate, but we cannot operate. And now we have the possibility, and this is what we do in some clinics in Germany, and. We just try firstly to deal with the skeletal muscle system, with the muscle system, process management, microcirculation, and then we get in Germany I get 60–70% away from all these chronic back pain, either it is knee or hip or spine, and only a small percentage needs operation. So we need surgeons, of course we need them, but the question is only, is the first focused soft tissue, or is the first approach the bone tissue? For example, and I can confirm, that the pain is coming from the soft tissue and not from the bones. So I must pose the question: is it necessary, firstly, to make an X-ray and NMR, or should I better use the same amount of money, directly start with the treatment of process management, and then directly the pain has gone? And if not, after 3 treatments, then I start with the X-ray, because it's not urgent to operate. You have time. Of course, when there was an accident, other case, then of course you need X-ray.
So, Doctor, one question to you is that, see, at the end of the day, what medicine is at the end of the day, it's also a business.
Yes.
Okay. So, in a country like India, where almost most of the population live below poverty line, okay, everything we talk is fine, but your medicine or your medical practices should be approachable, it should be accessible. Okay. So, considering this factor of poverty and underdevelopment and undernourished development, so the thing is that we rank. We find ourselves at a fag end of human development indexed, okay, which is called which is calculated by the average age that you live, life expectancy, education, and also with the nourishment or the undernourishment. Okay, so this is the country which is undernourished country. So what kind of suggestions or the observations that you want to put forth, considering all this aspect of India?
Of course, this is not an easy question.
It's absolutely not an easy question.
So you have to start with big projects like I think Minister President Modi does. I heard about a project called Clean Ganges, where they really start to go to the water problem, and that means it needs a systemic approach, where you really find out who is using the water, who is poisoning the water, and then you have to go to each company, to each group, discuss with them, and try to make the processes better. And then and the population, they must know that the pollution from outside today is tomorrow the pollution from inside. So, and every mother will understand, you know, that she cannot throw everything out here, because here the children are playing and maybe eating this and this and this and this and getting I don't know, poisoned from this and that, you know. So it is a question of consciousness, a question of education, and I'm sure that this problem can be managed. If you just compare it to Europe, 100 years ago in Europe the air was horrible, you know, in big towns. The rivers were poisoned, but today in the River Rhine in Germany you can swim, and the whole, from the beginning till the end, you can swim in this water. And so it can be reversed, you know, and this can be a good example for India. How did they do it in Germany to clean the water systems? What do they have there? And I hope that in future time, you know, these developed systems can directly be integrated there. Of course, things must maybe adapted and so on. But as an example, how to renew the whole country, this is given also in England. If you go to London, 100 years ago, it was not possible to breathe. You know, today it's wonderful, pretty town, and like this, there could be a very nice change.
Well, Doctor, you spoke about the systemic approach to this, because at the end of the day, when we talk about cells, it's a kind of a organ. It's a organic. It needs an organic approach. Mahatma Gandhi, a most celebrated philosopher in India, who said, which we also consider the father of a nation. Okay, in his whole, his philosophy is considered as the most organic philosophy. It's just because whatever economic and the political ideas he proposed at that point of time, the one very pertinent and important issue that he stressed on, and that is the health.
Yes.
For a good nation, you need a good health.
Yes.
Okay. So, what is your idea about accessibility of a health care?
Yes, it is.
And because we have this concept of a welfare state in India, where taking care of health is maybe a duty of a state. Okay. So what is the scenario in Europe as far as the public health is concerned, or the public policy towards the health is concerned?
Yes. So it is necessary that people. So the point is, you know, when does an animal move? When the animal is hungry. And so when human beings move when they are hungry. And normally when we are hungry, we should go hunting. And the man, you know, should go hunting every day, also here in the country, to the woods, and to go 5 kilometers, 10 kilometers for hunting, and then they bring some meat for the family. But what are we doing today? We don't go hunting, we just go buying there, or somebody brings it to the home. That means we eat the same amount or more than, because you didn't get every day something to eat, you know. So we have to go to a correct diet program. That means, and diet means just we have to be how can I say, very organized, you know. We have to move every day. We have to breathe, and we should do this during the daytime, you know. You can, for example, instead of horning, you can sit in the car and just breathe, you know, and laugh to the others, you know, because you cannot accelerate anyway, you know. So why do I get angry? Should I get angry if I'm in a traffic jam, you know? But you can just stay relaxed in the car and do some against your stress, you know. Just this is car yoga, you can say, you know. You just start with movement in the car, and you look here and you look here, and you move your joints in the car, you know. So you have at least 1 hour of time per day that you can positively use for your body. Yes, instead of horning and getting stress and more contractions. Yes. I just want. This was only one small example for those who are in the industrialized process. You know. For those who are the point is we have to look for our body. It is movement, exercising. And I know that many people have to walk here long distances, you know. So I cannot make a program and say in one sentence, this is for everybody. The easiest way is to say, do it like evolution wants it. And we are born as moving machines, not as sitting machines. But we are also born as human beings to think about positive things. We have to laugh, we have to be positive and to be happy at the end of the day.
So my very quick question to you will be, do you believe in this idea of universal health care?
It is a universal health care, and this was that was mainly planned from our creator. The system is there, but we disintegrated ourselves, and so we produce diseases. So if we shift back, it might be healthy.
So our last question to you, because this is a country which is obsessed with this idea of mujhe kya milega, which means what I'll get out of it. What will be your quick tips or the quick points to the Indian audiences to take care of their tissues?
Again, please, the question.
This country is obsessed with what I will get out of it.
Out of it, yes.
Yeah. So quick tips or the quick points for the Indian audiences to take care of their joints and tissues.
You mean everybody's on the ego trip?
Huh?
On the kind of ego trip. What can I get out of it?
Yeah.
Yes. At the end, you cannot get anything out of it because you cannot take anything with you. So this is interesting, you know. The main point is, and also I come to yoga, you know. Yoga is nowadays reduced to asanas, and this sells very good, you know. But as far as I have understood the yoga, it's the talk with the inner eye, and with whom I am talking there, you know. So we have to the mind has to talk with the matter, yes, and then of course the matter we will leave, you know, but the soul, as far as I have understood, will stay. So then I come to the karmic concept a little bit. So you cannot take anything with you. You can just consume, and mostly what you consume is against your life. It's too much. I like also to consume, you know, but from everything a little bit, but from nothing too much, you know. So you have always to be balanced. That's also the reason why I'm here at the moment in a fasting program in a retreat center, where I just get a very, very small amount of nutrition, and where I just calm down, and also calming down the mind and thinking about where do I come from, where do I go to. These are the main questions that we have to focus in our lives, beside our jobs, of course. This is very important also.
So to sum it up, knowing our existence, and we should learn why we exist and why we should exist.
Exactly.
Dr. Randoll, it was pleasure talking to you. So nice of you coming here, coming to Tapobhumi, meeting Swamiji, and giving us a very beautiful interview, very informative interview. We look forward to your visits again and again to Goa, and you are a guest to India. Nice talking to you.
Thank you, Mr. Naik. Thank you so much. Thank you so much. Thank you.